go
So we
next.
have a next talk by Dr. Ritesh Verma, and he'll be speaking on isolated conjunctival lymphangioma, a challenging diagnosis. Oh, okay.
So again, good afternoon, and I hope you're not feeling sleepy. And I'll try to not make you asleep with this lesion. So we have a 15-year-old boy who presented with this painless pinkish mass on the bulbar conjunctiva of the left eye, which was persistent and progressive, non-progressive for the past 6 months. The anterior segment, the adnexa, they were all normal. So on examination, you see there is a well circumscribed lesion which is subepithelial, which is adherent to the conjunctival epithelium, and it is non-reducible and non-pulsatile. And what is peculiar is this superiotemporal tortuosity in the conjunctival and the episcleral vessels. And this patient had already used steroids 4 weeks prior to the presentation. And another feature is the presence of these superficial petechial hemorrhages on the surface of this lesion. So there were numerous large as well as small hemorrhages on the surface. So what we decided is to excise this lesion and to cover the lesion with a amniotic membrane, a fresh amniotic membrane graft. So this is the post-operative day 7 picture. You can see the lesion is removed and the surface is covered with the amniotic membrane. And on day 28th, you see there is regression of the vessels and you see there is a conjunctival scar. Now, on histopathology, you can see there is layer of endothelial cells which are lining these channels, and these channels are filled with lymph-like fluid. And there is an insubstantial stroma, and there were only few aggregates of lymphocytes between these cells. And on immunohistochemistry, it was positive on ERG1, which is the differentiated endothelial cells. So based on the morphology and the immunohistochemistry, we diagnosed it as a lymphangioma. And there is a very famous tweet by a very famous president which says that lymphatic malformations are just low flow and high drama. And why I say that is because Shields told us that lymphangiomas look like this on the ocular surface, like a bright red lesion, which is a component of a deeper orbital lesion. But in the literature, if you search isolated conjunctival hemangiomas, there is all sort of literature which has been labeled as lymphangioma. So this is a salmon colored lesion which is published as a lymphangioma. This creamy colored lesion is also labeled as lymphangioma and with the same histopathology findings. This looks somewhat like what was described and it's an isolated lesion. This is also labeled as lymphangioma, but we all know that this is a hemorrhagic lymphangiectasia now, and there are studies with ASOCT which has confirmed that there are blood-filled small cystic vessels. And recently, I had a patient which had a hemorrhagic lymphangiectasia which was proven with biopsy. So what I want to tell you is that lymphangiomas can have varied presentations, and we have various treatment options like observation excision and fractionated radio. So if you have a case which looks like this, so make sure to document it, right? Thank you.
This word lymphangioma is not used nowadays.
It's a venolymphatic malformation
Okay,
or
it's
low
a
flow. Yeah.
venolymphatic. So I would just want to ask you, did you do any imaging of this patient?
Imaging
Because
we
they
did,
can have connections
correct.
to other places. Did you examine the palate or
We did examine the
mucosa?
palate. That's the routine when we get a lymphangioma, and we did order a CT scan, which was absolutely fine. So this
No,
was,
it's important to any vascular lesion. It's important to know the hemodynamics.
yeah, it
So
was not connected to anything in the orbit or as well as the palate or the face. So it was an isolated,
sometimes,
yeah,
even if it appears isolated, you have to get an angiogram. You'll see some connections elsewhere,
right.
and you have excised it, but it could have been managed with the local sclerotic agents. You know, that is bleomycin is being used now.
Right.
So, because I remember I had a case, it looked like isolated, but when we did we excised it after we used glue to solidify the lesion and we excised it. After that, immediately on the table, this was the only case I did under local. I do most of my cases under GA. So this is the only case she had pain in the nasal region. And when we reviewed the imaging, there was a subtle involvement of the nasal mucosa. So I think we should do imaging for all these patients, even if it looks isolated, it should be done.
Well, on the first appearance, I didn't know that it was a lymphangioma. It was only after the
We don't say
histopathology.
lymphangioma, lymphatic malformation. Anyway,
Yeah.
you suspected a vascular lesion, isn't it?
Yes.
So we need to have, that's the
Correct.
only thing I want to add to it. Otherwise, it's good.
Thank you.
Thank you.